today to talk about is penile implants or penile prostheses for erectile dysfunction. And firstly, we'll be covering the causes of erectile dysfunction, and then we'll do a brief overview of each of the three different devices that emerge. And we'll talk about the location of the components in the body for each of those, how each device operates, pros and cons for each of these implants, and complications, surgical complications. So to talk about the causes of erectile dysfunction, there are essentially four main causes, and they are vascular disease or malfunction of the blood supply system. Diabetes is also another major cause, and that is actually associated with blood supply disorders as well. And then the third most common is surgery of the pelvic area, and it's in particular surgery for cancer of the prostate, removal of the prostate for cancer, and pelvic trauma. They're the main causes of erectile dysfunction. So to talk about the devices, there are three essential devices that the company makes. The first one, the most simple, is called a Spectra device, and it's simply a malleable pair of rods which are manipulated up or down for concealment or for intercourse, or to produce an erection. And then the second device that we make is called Ambicore. It's a semi-inflatable device, semi-concealable device. It simply has a pair of cylinders, inflatable cylinders, with some small reservoirs at the back end of the cylinders, and a small pump to inflate. And then there's what we call the 700 range, which is a three-piece device, which is much more natural and more mimics the natural body function much more closely. This is the Spectra device, which I have just one rod with me, but every penile implant, regardless of the type, involves the placement of either two rods or two cylinders into the two cavities that run along the shaft of the penis that would normally become engorged with blood to produce an erection. These prostheses or implants go into those exact same cavities. So the rod or rods are placed in the shaft of the penis into those cavities that are filled with spongy tissue normally, which extend from the middle of the head of the penis all the way down to the bony pelvis, which is well inside the body, to the bottom of the pelvis. That spongy tissue is dilated to accommodate the cylinders, the rods or the cylinders. This device is simply bent down for concealment at the body plane or bent up for intercourse. And obviously it's the simplest of all of the devices that we make. So there's very little to go wrong with this device, very little to malfunction with it. It's probably the most dependable, most reliable of all the devices. However, it does have some drawbacks, and that is that this is a permanent erection which needs to be simply bent down for concealment. This may be a problem for somebody who's young and physically active, or who's dressing and undressing in public places such as the gym or the golf course. So that may not be a desirable device for somebody who is young and physically active. However, it may be perfectly suitable device for somebody who is older and less physically active. Then the second device in order of sophistication is this semi-inflatable device, or it's called Ambicor, and it consists of 2 cylinders and a small pump which is located in the scrotum, superficially in the scrotum. And again, you can see quite clearly from the anatomical diagram that it sits just underneath the skin so that the patient can readily locate it and manipulate it. And again, the cylinders run along the shaft of the penis, just as the rods from the middle of the head of the penis all the way back to the bottom of the pelvis. To inflate this device, the patient just simply takes a hold of the pump through the skin of the scrotum like so, and several pumps of the pump transfer a small volume of fluid from these small reservoirs at the back of the cylinders into the body of the cylinders until it gets rigid. And this device just simply gets firm and rigid, and it will remain that way for as long as the patient requires it. And then to deflate, it's simply a matter of placing the thumb underneath the penis at the body plane and bending down and holding in that bent position for 4 seconds. There is a little delay built into this device to prevent inadvertent deflation. And after holding it in that position, that releases the valve, and then it's simply a matter of squeezing the cylinders for full deflation. And you can see that those cylinders are now deflated and flaccid and can very easily be concealed in the underwear, in the patient's clothing. So that's the Ambicor device. And then the third and most sophisticated of all of the devices that the company makes is what we call the 700 range. And this consists of 3 components: a small pump, which is again located superficially in the scrotum as before, with the main difference with this device that it has a larger reservoir which is located in the pelvis adjacent to the bladder, and you can see that clearly from the anatomical diagram. And then the 2 cylinders, which again lie in those same cavities and extend from the middle of the head of the penis back to the pelvis. To inflate this device, again, the patient just takes a hold of the pump and pumps through the skin of the scrotum. A number of pumps depends upon the length of the cylinders. We have a range of cylinder sizes to accommodate all anatomies. So this patient simply pumps the pump until the cylinders fully inflate, and the pumping of the pump is transferring the fluid from the reservoir into the cylinders via this sequence of tubing. And the thing that sets this device apart from the others is that it's the most natural of all the devices. It mimics the natural erectile state more closely than any other device. The cylinders will expand girth-wise and extend lengthwise, so that it's truly a physiologic device. So normally these devices are filled with fluid. This one here for demonstration is just air-filled. But you can see quite clearly that it still inflates quite well just with air. And to deflate this device, it's simply a matter of locating this small button at the top of the pump and pressing and holding for 4 seconds. And again, there's a built-in delay mechanism in there to prevent inadvertent deflation. And then after 4 seconds, this will automatically and slowly deflate, just like the loss of erection, natural loss of erection. But to deflate the cylinders more rapidly, it's just simply a matter of taking hold of them and squeezing, and that rapidly transfers the fluid out of the cylinders. And you can see again that these cylinders completely deflate. This reservoir is big enough to receive all of the fluid out of these cylinders. Just to talk a little bit now about complications. The single most common complication with this procedure, as with any surgical implant for that matter, is infection. The rate of infection, or the incidence of infection, is low. It's less than 1%. However, it is a major concern because infection can often be a disastrous outcome involving the removal of the entire device. For a patient who has a penile implant, it's very, very important to be mindful of any potential infection anywhere in the body and respond quickly, very promptly to very quickly arrest that situation. Then the second most common complication is erosion, and often infection and erosion are linked. However, erosion simply means the wearing away of the tissue due to pressure, to the degree that the device protrudes through the tissue and ultimately through the skin to the outside of the body. This can be a result of poor vascularity or poor blood supply, but it can also be a result of improper sizing of the device. So the surgeons that implant these devices take a great deal of care to ensure that the device is properly sized. One thing that I wanted to stress at this point is that this is in no way a penile lengthening or penile enlargement surgical procedure. It is simply designed to restore the loss of erectile function. Post-op expectations with all of these devices, it's important that there is a delay from the state of surgery to the first use of the device for intercourse. And it's usually most surgeons will require a 6-week wait post-op before the device is used, and that's purely a infection control measure. It's important that the wound is completely healed and completely clear before intercourse